Hand, foot, and mouth disease is making the rounds, and doctors say those cases are spiking right here in East Tennessee. WBIR 10 News reporter Sean Franklin found out more about the disease. And Sean, this summer the entire family needs to be careful.
Yeah, Robin, hand, foot, and mouth disease is mostly found in kids, but doctors say while it's rare, it can also reach adults. It causes fevers, rashes on hands and feet, as well as blister-like sores in the mouth. But it's the rash that sets it apart from the flu.
I had a year, maybe 2 years ago, both of my children had hand, foot, and mouth at the same time.
Family nurse practitioner Michael Norman has dealt with hand, foot, and mouth disease personally.
The 4-year-old had a case that was much milder than the 2-year-old. The 2-year-old's rash was just horrible. She was very uncomfortable.
The virus typically only affects young children.
The age range that I've diagnosed it in recently is, the 5 or 6-year-old range.
But adults can get it too.
The rash is typically a lot worse with children. The older you get, the rash is not quite so pronounced. But now some of the other symptoms you get, the flu-like illnesses or the flu-like symptoms, that seems like adults struggle with that a little more than the children.
To make it worse, Norman says the cases are spiking in Knoxville.
A lot of times the parents may or may not even realize that the child was sick.
Symptoms look like the flu, but when you see a rash, you know it's hand, foot, and mouth.
So the children sometimes will get rashes in their mouth, blisters in their mouth, and that's somewhat painful.
The virus can be spread easily, especially in places like daycares.
Daycares are tough. Kids don't know hygiene, and there's no teaching the kid hygiene. And then you throw in the fact that parents use daycares because they have to go to work, and so the parent is forced to. You're in a position where I have to send my child that may or may not be sick to daycare, or I'm going to lose my job.
Ultimately, keeping the house wiped down and washing your hands will help.
Norman says hand, foot, and mouth is a virus, so you've got to wait it out, drink plenty of fluids, and use a pain reliever to help. Robin?
And like you said, wash those hands. Sean, thank you.